We have been spending the morning thanking all of our health workers across the country and also getting a nice insight into what their jobs actually involve.
Erin Longbottom leads a team in Sydney who are working to test and vaccinate people experiencing homelessness. And Erin joins us now from St Vincent's Hospital in Sydney. Good morning, Erin.
Good morning, Lisa. How are you?
I'm good. Thanks so much for coming along. Hey, tell me what the challenges are about trying to ensure that those who are living rough are still getting vaccinations.
Well, I think the issue really is that we know people experiencing homelessness find it more difficult to access healthcare in general, which is why my team exists. So really, we did start really early vaccinating people experiencing homelessness and in social housing when vaccines first came along. And now we really feel like we're in a race against time to go out there and vaccinate people who are sleeping rough, who have much poorer access to vaccines. So it's really just about ensuring vaccine equity.
So how are you doing it? How do you make sure you try and get the people who need it?
Yeah. We have to take vaccines to them and make it as easy for them to get a vaccine as possible if they want it. So there are people who really struggle to make an appointment time, to get to a service, to come to a vaccine clinic. And so we want to make sure that those people really are able to get a vaccine if they want to. So this morning, my team are out there on the streets patrolling with our vaccine outreach team and making sure that people who wouldn't be able to come to a clinic can get a vaccine.
Are you finding many homeless people are testing positive?
At the moment, we are starting to see a few cases in the homelessness community, which is actually really quite confronting because for people experiencing homelessness, they have a much higher rate of chronic disease and other comorbidities. So if they were to contract COVID, they would be more likely to get sick, and there's other sort of issues surrounding that as well. So we're really we feel like we're in a real race against time at the moment to just make sure as many people can get access to vaccination as possible and that we're providing testing to as many people as possible so we know if they're COVID positive and we can support them appropriately into hospital or other safe accommodation.
Quite a few people you work with, Erin, think you're very special. Can I read one out? I don't want to embarrass you on live television, but Amy Kaysen said that Erin is deeply committed to our homeless health and she pours her heart and soul into keeping us all safe. We're so happy you're here with us every step of the way. That's from Amy. Erin, how are you looking after yourself?
Well, I just have to say I'm so lucky to have probably the best team in the world. Every single one of my team members is incredibly dedicated and we laugh together, we work together. There's so much team mateship and we all care so much about our homeless community that I think just seeing them go above and beyond every day is just such an inspiration to me. But my family is really what I think also inspires me. Like being able to go home to them, they're really incredible. My daughters and my wife, but also we've been through a tough time. It's been COVID, but all our networks, our friends, we've all been there for each other. And I think that's what also gives us hope through this time is people pulling together and really looking after each other through this really tough time.
Bet you're running on adrenaline at the moment.
Oh yeah, so much adrenaline. It's but it keeps you going. It really keeps you going. Every morning you wake up, you do not know what the day is gonna hold. I constantly are waiting from a phone call or an email from the public health unit and that sort of will shape how the day is unfolding at the moment.
Erin Longbottom, so good to have you on the program. Thank you for all the work that you do, but also because you are such a team player and a great leader that your team as well, huge thanks to them.
Thank you, Lisa.